it is soft and why there is no C-shaped cartilaginous ring is because the esophagus will get accommodated there. The esophagus will get accommodated in the trachealis muscle, that is exactly posterior. So anteriorly you have C-shaped cartilaginous rings and posteriorly you have the esophagus which is present exactly behind the trachea, right? Now I will tell you the clinical application, right? If you take the endocrinology, what did we discuss? I have shown you large multinodular goiter, okay? What was the indication for surgery in case of a multinodular goiter? So, if there is a large multinodular goiter, right? If that large multinodular goiter causes the pressure symptoms, what is that pressure symptoms? Like you see here. Now, this is the trachea. For example, if that large goiter, if it compresses the trachea, right? If it compresses the trachea, what will happen to the respiration? There will be difficulty. So there will be dyspnea. Understood? Now, that is one pressure symptom. The other pressure symptom is that, you see this is the esophagus. And if that particular goiter, where is the trachea present? Trachea is present anterior, where is your thyroid gland present? Thyroid gland is present anterior to the trachea. So, if that particular large goiter compresses both the trachea and as well as the esophagus, both, it is like compressing. So what will happen to the swallowing? Dysphagia. So whenever there is like tracheal compression or whenever there is esophageal compression, then what you have to do? You have to remove that particular goiter. You have to surgical resection of that particular large multinodular goiter. That is the indication for thyroidectomy. That is the indication for thyroidectomy. Now, the other important thing is, so you see this is a large trachea which is continuing down, and how it will divide into? It will divide into the two important bronchi. So we have the right main bronchus and as well as the left main bronchus. So I will try to show that. Okay. So you see this. So this will be right. I'll try to dissect that. So this entire thing is trachea which is coming down, and I'm trying to cut the tissue which is present above the trachea. So whatever the division, right. So now, yes, Shashi, you are telling something Karina. I think you like Kareena Kapoor a lot, but Karina, where will be your Karina, Shashi? So Karina, what exactly is your carina? Carina is where the trachea bifurcates. The trachea where it bifurcates, that is what is your carina. It is not the place where your upper and lower respiratory tract is being divided. Okay, right. So I will try to show you that carina. I cannot show Kareena Kapoor, but Karina I will show. Right. So this exactly is the carina, where there is division of the trachea into right and as well as the left main bronchus. So what I am cutting is the tissue which is present around the main bifurcation, that is the carina. Okay, so can you see this bifurcation? Right? Can you see this? So this exactly is the carina. That is the division of the trachea into the right and as well as the left main bronchus. Okay? Now, what is the importance of this particular carina in the cardiac cases? You take in mitral stenosis. In mitral stenosis, which particular chamber is enlarged? Why right atria will be enlarged? Left atria. So in mitral stenosis, there will be left atrial enlargement. Now, exactly behind what I have is the left atria of the heart. This is the heart. Okay, so exactly behind what I have is the left atria. Right, this is the left atria. And if this particular left atrial enlargement occurs, what will happen? Whatever this particular carina is there, right? It is not pushed upwards, it will be widened. It will be widened. So there will be widening of carina. So that is you will observe in the chest X-ray. You will observe in the chest X-ray that there is widening of the carina in patients with mitral stenosis. And why is that widening of the carina? That is because of left atrial enlargement. Okay. So this is what is the right and as well as the left main bronchus. Okay. So and this entire structure. What is this entire structure now? This is what is your mediastinum. What is mediastinum? It is the one which is present between the two lungs. So what are all the parts of your mediastinum now? You have the heart. And along with the heart, you have the great vessels. Right? Along with the heart, you have the presence of the great vessels. Okay? Actually, one second. Right, it should be like this. Okay. So, this is the esophagus. Right. I will show you one important structure. You should tell me now. Okay? Yes, who will tell? Yes, Amir, you will tell what is this structure? It is your aorta. So, you can see that here. So, day before yesterday when we have done the dissection of the heart, right? So, I could just make out where is exactly the origin of the aorta. Now, in this specimen, I will show you the entire arch and as well as the descending aorta. Okay? You want thymus, huh? Thymus will be there in adults, Amir? Children, yeah, children ka hai kya? Right. So you see this now. Beautiful arch of aorta. Okay. Can you see this arch? Is that clear? So this will be your arch of aorta. Right. So what are the great vessels which are originating from arch of aorta? So you have right brachiocephalic artery. Then left common carotid artery and then left subclavian artery. So these are the three great vessels which originates from this arch of aorta. This particular arch of aorta. Is that clear? Next. Now, the other important point is regarding that particular great vessels. So, I mean, today and as well as yesterday, I was discussing about, today only, I was discussing about the cardioembolic stroke, right? And this cardioembolic or your thromboembolic stroke may lead to what? May lead to the development of cerebrovascular accident. Why is that? So, from the arch of aorta, you have left common carotid artery and right common carotid artery, which is going to the brain. And from the heart, if there is any embolus which enters into the ascending aorta, it will enter into the arch of aorta. From the arch of aorta, it can enter into the brain and it will cause ischemic stroke. It will cause ischemic stroke. Okay? Right. Now, and after this is your arch of aorta. After the arch of aorta, you can observe the descending aorta. You can observe this entire thing is your descending aorta. Let me take out this entire tissue so that you can appreciate it in a better manner. Okay, fine. So this will be your descending aorta, which will be continuing as the abdominal aorta. Now, you take the arch of aorta. What is the surface marking where the arch of aorta starts and where this particular arch of aorta ends? That's a multiple choice question in anatomy. Where is the, see, you have ascending aorta, arch, and then descending aorta. At which, what is the point where the arch of aorta starts? That is at your T2, that is at the angle of Louis. Exactly at the angle of Louis, the arch of aorta starts. Then it continues. And it will also end at T2, right? But on the other side. And then it will continue down as the descending aorta and further as the abdominal aorta. Understood? And from the abdominal aorta, I'll ask you one more important MCQ. From the abdominal aorta, what is the first important artery? Celiac trunk. The first important artery which will be originating from this particular abdominal aorta will be celiac trunk. So celiac trunk supply which part of the GIT? It supplies the foregut. Celiac trunk will supply the foregut, whereas midgut is supplied by superior mesenteric artery, and hindgut is supplied by inferior mesenteric artery. Okay, so that is about the story of your arch, descending aorta, and as well as the abdominal aorta. Now, very important point is discussion related to the mediastinum. Discussion related to your mediastinum. So now this is the mediastinum, and the trachea, it is like centrally placed. Okay, now this is the left lung, right? This is the left lung. What is this part of the lung? Apex. Apex. This is the apex. And what is this particular part of the lung? No, I am showing you one. That is your place where the costophrenic angle will be. That is place where the costophrenic angle will be. Okay, right. And what is this particular part of the lung? Yes, you see this. What is this? So that is, yeah, middle lobe. You don't have middle lobe. In the left side, do you have middle lobe? So left side you have only two lobes. The upper lobe and as well as the lower lobe. And what is this extension called? This is called lingula. This is called lingula. Now.